Right. So yeah, thank you, Professor Braga, for those kind words and an introduction. And I must say it's an absolute pleasure, and not only pleasure, an honor to be speaking today for this ESA lecture. Pleasure because I belong to ESA. I have studied there, and like you mentioned, I was the first one of the first cohorts who got ESA PhD fellowship back in 2007. So I was there from 2007 December 2000, January 2008 onwards until end of 2009. So yes, coming back to ESA, now sitting on the other side of the table and delivering a lecture of which I have been witness of several of those lectures when I was there in ESA, and I'm sure the tradition is continuing as I hear from other ESA PhD students. So therefore, it becomes an honor for me now that I am getting this opportunity to be on the other side of the table and giving this lecture. Now, you mentioned about how I moved from bioinformatics to positive pedagogy. I must say I haven't really moved. I'm still into bioinformatics. It's just that today's world, today's academic and research world, expect us to be doing research in multidisciplinary fields, in different fields, and I will tell later how I got stumbled upon this pedagogic area, and how this the project which I will discuss today and the results I will show today, how it came through. So anyways, just picking up from where I left, which was in 2010, when I completed my PhD from University of Bologna. You mentioned I moved to a couple of places, and yes, indeed, I was in Vienna for 6 years as a postdoc, and then traveled a couple of countries, and then moved to Ulster University in 2016, and I'm here since July 2016, teaching bioinformatics, computer programming, data analysis sort of subjects in multidisciplinary sort of courses. And one of the courses which I will talk today, which is taught here at Ulster University, is called BSc in Stratified Medicine. The new name of the course is BSc in Personalized Medicine. And I very much recall, Professor Braga, you asked once, what's the difference between stratified and personalized, or what exactly the stratified medicine is. And that's the question what many people keep asking me, because it's a new term, it's a new field, and there are differences between the terms, minor differences. However, people use those words as an alias to each other. I will come to that as well. So yeah, so I'm teaching several different subjects, doing research in application of machine learning. So I'm still into machine learning. So I'm doing applying machine learning in the context of personalized medicine, where we are trying to look for different biomarkers, mainly in the inflammatory diseases which involve inflammation, such as diabetes, rheumatoid arthritis, and so on. So we are looking for biomarkers for diagnosis, for prognostic, and different areas in personalized medicine. Now, when I joined here, so the story of how I stumbled into this pedagogic research. So when I joined here in July 2016, like any new recruit, not only this Ulster University, but any university in the United Kingdom, they ask the new lecturers to do a postgraduate certification course in higher education research and practice. So, which is basically a 2-year sort of part-time program, which every new recruit has to go through during the 3 years probation period. So within the 3 years, we are supposed to complete and pass that particular course. So the project which I will talk about actually got conceived during those 2 years. So 2016, 2018, the project got conceived. And I used that, I developed that project as a part of my final year dissertation for that postgraduate certificate course. And then it went further evolving into a research funded project from Advanced HE, which is one of the funding body, major funding body here in the field of pedagogic research. Anyways, so starting with the presentation, plan of this presentation, I have basically divided into two major things. The first is I will talk a little bit about the background and the context around these words, the new words nowadays, positive pedagogy and personalized medicine, stratified medicine, and different disciplinarities like cross-disciplinary, interdisciplinary, multidisciplinary, transdisciplinary. People use them, as an alias to each other, but there are, minor differences between them, and I will come to that. And the challenges and the need of positive pedagogy in the multidisciplinary courses, especially in the context of higher education. So I will set up some background for 10-15 minutes, and then I will come to the Advanced HE funded research project, where I will start with the objectives and the participants and how the evaluation was done for this particular in this particular project, and what methods of teaching, assessment, and feedback were used, and how the results, both quantitative and qualitative data were generated, how they were analyzed, and what were actually the findings and the conclusion of that project. And then with acknowledgements and further readings, we'll open to questions and any discussions or any comments thereon. So first thing first, which is the background and the context. So I would like to draw attention of the audience here to this particular paper, which talks about positive pedagogy. And to my knowledge, this is the first time I searched a lot. This is the first time I saw the term positive pedagogy being used. So I believe that these people are these two authors, Mia O'Brien and Levin Blue. They introduced this term in 2017. That's when it was published online. And they talked about the need of positive pedagogy, especially in the primary education context, and what all teaching approaches should be used, and why they should be used, and how can we facilitate and support a positive sort of environment in the primary education sector. Now, like I said, these, to my opinion, these are the people who actually coined the term in the field of pedagogy, positive pedagogy. And this particular article talks about an action research where they explicitly talk about the practices which target the development of students, three major things: so positive cognition, positive emotions, and positive experiences. Now, the point I want to make here is, like, we talk a lot about student experience these days, especially, I hear a lot about in my university that, we need to make sure that the student experience in terms of their teaching and learning is as good and as best as possible. But what difference this positive pedagogy, or this whole concept of positive pedagogy, is trying to bring in the arena of pedagogic research is, it's not just about student experience, but the positive emotions they should have while the journey of their education, and the positive cognition as well. Now, that was about positive pedagogy. The next thing I wanted to discuss in terms of background is this disciplinarity. So cross, inter, multi, and so on. And there are so many terms. And I found this blog where this guy, Alexander Refsum Jensenus, who is a music researcher in Oslo, University of Oslo. And he has tried to put together, by reading a couple of papers, he cited those papers in the blog. He's tried to put together a narrative, a brief description around how these different disciplinarities actually differentiate from each other. And he very nicely presents this in this pictorial representation here. And if we move on to the next slide here, he mentions that intradisciplinary is something where people study a single discipline in isolation, in silo. Whereas cross-disciplinary is the second figure, where you have so many, is the middle one, where you have so many disciplines which are studied in a very close proximity from each other, as close as that you try to visualize or perceive, view the one discipline from the perspective of the other discipline. Whereas the multidisciplinary is like when you have different subjects or different topics which are studied even though together, but you still, people from different disciplines, they work together, and they each draw their disciplinarity knowledge, their discipline specific knowledge, But what differentiates multidisciplinary from cross is that they don't view the other discipline from the perspective of their own discipline. Interdisciplinary is when things fuse, when the subjects fuse and a new subject is evolved. And a very good example, being a student as well as now a teacher of that topic is bioinformatics as a subject, to my opinion, is an interdisciplinary subject because it has taken knowledge from different subjects like mathematics, statistics, computer programming, biology, medical science, but all of that has fused in and evolved into new concepts and theories which stand on their own, and they now belong to bioinformatics. So to my opinion, interdisciplinary, one of the nice example of interdisciplinary subject is bioinformatics. Now, the bioinformatics subject, when it is taught, then the course in itself, the whole program in itself, to my opinion, is a multidisciplinary program or multidisciplinary course, because when it is taught, when the program is taught, you have to study mathematics as an standalone subject, computer science as a standalone subject, biology as a standalone subject. And there are, in the later part of your bioinformatics undergrad degree or master's degree, you study the core bioinformatics, but as a starter, you have to get the basic concepts of math, stats, computing, and on. So to my opinion, bioinformatics, when taught as a program, it becomes a multidisciplinary course, but there are topics within bioinformatics which makes it an interdisciplinary subject. Another example, and which I will talk here later, is about BSc honors course in personalized medicine, which again, to my opinion, is a multidisciplinary course. And it involves interdisciplinary subjects, cross-disciplinary subjects as well. The course itself is a multidisciplinary course. There is another term here used called transdisciplinary, which to my opinion doesn't differentiate too much from interdisciplinary. The only point I note here is that it's the subject or the concepts which have evolved after interdisciplinarity, that the concepts are transferable and these can be applied to other fields as well, and that's how the whole thing becomes transdisciplinary. So I just thought maybe it's important to emphasize here what is the difference between cross, multi, and inter, especially because I will be using these terms in the later part of my talk. So that brings me to this very specific multidisciplinary STEM course, which is taught here at Ulster University, of which I'm part, and I teach computing and bioinformatics related modules here. So it's a 3 to 4 years program, depending on whether someone is taking a 1 year for industrial placement or not. So, but otherwise, it's a standard 3 years undergrad program. And the course content is built by in conjunction with, in liaison with the industry experts. So we have an annual meeting with the industrial experts, and we call it as Industrial Liaison Committee. And they inform us that what are the skills they would like us to teach. And obviously, the whole industry sector is expecting more and more with time. And that, to be honest, I feel has helped in shaping up this particular course, where the expectations are that the students should know the experimental wet lab skills, so that, meaning they should be able to go into the lab and do experiments. And now these experiments, which involve human subjects and human cell lines, they should also therefore know and be well versed in the clinical governance and regulatory processes and all the ethics involved when someone is dealing with human subjects. And they should not only be able to understand the governance and ethics process, but should be able to write ethics applications and research governance application to the ethics and governance body, because before conducting a project or research study based on human subjects, you have to go through all those processes. And they should not only generate data with the experimental skills, but they should also be able to analyze that data. So therefore, it means that they should have statistics, computing, and data analysis skills as well. So to my opinion, this course is really challenging. It's very difficult, but at the same time, we try to emphasize and do our best in terms of the teaching and learning process, and we keep close contact with the industrial experts, and we try to bring in their visiting lectures as well, and try to help our students to go for industry placement as well. But in terms of making sure that we are doing our best, it's important that we reflect on how we are teaching and what we are teaching. And like I was mentioning, this is a multidisciplinary course, so it involves like 14 in total 18 modules, or in other words 18 subjects, which are taught across 3 years, and which means 6 subjects each year, which means roughly 3 subjects per semester. So now, out of these 18 modules, 4 modules are computing related, and each module roughly has at least 1 programming or scripting language. Now, to my opinion, again, teaching 3 to 4 computing language, which definitely is informed from the industrial experts that they really want, is, to my opinion, is quite daunting task for students who especially are not coming from a computing background. So most of them are biomedical sciences background students. And so in essence, I say that we actually try to create super graduates with this course, and who should know everything, as many subjects as possible. So math, stats, computing, biomedical sciences, ethics, governance, and they should be able to do anything, which means they should be able to run experiments, analyze data, etc. And if we think around current multidisciplinary courses, this is not the scene of just this particular course. To my opinion, all those multidisciplinary courses which have been recently launched in the last 5 to 10 years, they are really demanding, they are really challenging. And especially subjects such as computer programming, which the pedagogic research backs up and says that it is a difficult subject to be taught and to be learned. And it becomes, to my opinion, more daunting if someone is not really coming from a computing background. So increase in market demand, and there is an increase in the expectation from students. And I like to bring attention here towards these 3 cool terms, which have evolved again since last 10 years, or I must say last 20 years. I remember when I was in my school, I used to hear these words, specialization. So someone has graduated and then has specialized in blah, blah, blah. With time, I remember during my master's and PhD time, I started hearing a new term called super specialization. And this term, super specialization, is nowadays very commonly used in medical fields. So medical doctors, they have this super specialty sort of courses, which they say that they have done a super specialization on a specific thing in the medical field. And now this multi-specialization, the term has evolved and has come up, where the expectation from students is to not just specialize or super specialize, but actually super specialize. So the point I'm trying to make here is that this greed of more and more, in one way, it's good. Obviously, we are trying to learn more and more, but at the same time, it is creating more stress and anxiety and pressure on students because of the high expectations from them. So students are challenged by the breadth of skills they are expected to learn across different subject areas, and they find it stressful. It's not just me who's saying, but this is all backed up by the data. And currently, most of the universities, this is really a hot topic. The mental health and well-being of students, and not only just students, but staff as well, is one of the really hot topics these days, and being discussed and researched and facilitated in terms of addressing mental health and well-being in most of the universities. So what I'm trying to advocate is that learning and teaching methods, they need to change, they need to adapt with time, and especially for these multidisciplinary courses, where the students are coming from very diverse background and they are expected to learn very diverse subjects. So we need to really move on from the classical lecture followed by practical sort of concept. And I'm aware there are changes. People have been People have been innovating and trying to use different ways of learning and teaching. But in general, this is fine. But when it comes to very specific for multidisciplinary courses, I personally feel that more efforts are needed. And we have been advocating that in one of the recent opinion piece article, which me and my colleagues have published in higher education pedagogies, where we have tried to advocate that there is a very strong need for the positive pedagogy in multidisciplinary STEM courses in higher education. And this ends my background of the context of the project, which now I will talk about. So this particular project, like I was mentioning, actually the idea got conceived during my postgraduate certification course in 2016, 2018. But in the late 2018, around December 2018, there was a funding call from this funding body, Advanced HE, regarding, they were looking for ideas, especially interventions, teaching interventions, which could address mental health and well-being of students. So around December 2018, we submitted that proposal, and in January end, we got the results, and we were fortunate to get funded. And from February 2019, the project went on live, and that's what I will discuss now. So the title of the project was, we were trying to develop some interventions through teaching and learning practice for addressing stress and anxiety in students, which is caused due to the challenge of studying a cross-disciplinary subjects. So the term came here, cross-disciplinary, for which I tried to give some background before. So in this context, the cross-disciplinary subject is computer science, which do exist as a standalone subject, and people study BSc or undergrad courses in computer science as a standalone program. But here, when we teach computer programming to biomedical science students, we try to teach them from the perspective of the biomedical sciences. And that's how a subject which was an intradisciplinary subject becomes a cross-disciplinary subject when it is taught in the context of a different program. Now, the team consisted of a colleague from my own university, Professor Stephen McLean. He's a professor of biomedical education. And another co-investigator, Dr. Elizabeth Hitson, who is an education researcher from University of Sunderland. So with the team of 3 people, we put together a grant application, and this got funded from Advanced HE. Now, in terms of objectives, our core objective was to identify the aspects of teaching, assessment, and feedback, all 3 pillars of teaching and learning we were trying to address. So what are the aspects of all those 3 pillars, teaching, assessment, and feedback approaches, that could improve students' 3 things? The first was the self-confidence, because we know that computer programming, especially when you are not from that background, I see that students are quite low in confidence. So we wanted to really address their self-confidence. Well-being, because obviously it causes a lot of stress and anxiety. So the well-being was important, their mental health was important. And obviously computer programming is a skill which has a lot of job prospects. So we wanted to prepare them for the job sector after graduation as well. So these 3 things, were the core objectives which we wanted to achieve by changing or by innovating or improving the teaching, assessment, and feedback approach. So this was run during the academic year of 2018-2019, semester 2, which means February 2019 until June 2019. The multidisciplinary course was BSc Honors in Stratified Medicine, final year students, and module was biomedical informatics, where we study data analysis of biomedical sciences data. But in the first half of that module, we focus on learning computer programming, some of the scripting languages, which they apply in the later part of the module in the context of data analysis. And the number of students were 14. Now, I said earlier that I would come to this point, that what is stratified medicine, because before I move on, I think I should explain a little bit more about this particular course. So stratified medicine, I must say, is a more humble way of calling personalized medicine or precision medicine. So these 3 terms, personalized, precision, or stratified medicine, they are used very often in place of each other, so like an alias of each other. Stratified is a more UK term, which basically means group. So whenever we are trying to find groups of patients which have sort of common etiology, or which can be diagnosed in a more stratified or in a more group, for example, response to treatment, you might find that not every patient is responding equally well to a particular drug. So you might be able to find groups of patients which might have different response to treatment, and then accordingly you can tailor their treatment. Now, from stratified, you can be a bit more ambitious, and you could move to personalized medicine when you talk about an individual person. So personalized medicine has become a more global term nowadays. And if you want to be further ambitious, the term is precision medicine, where you exactly focus or narrow down to a specific part of the body where the treatment is supposed to be delivered, or diagnosis is supposed to be done. So precision medicine is more of a US term, as far as I read out, and stratified is more of a UK term, and personalized, which is somewhere in middle, is more of a global term. Now we have moved from stratified medicine to personalized medicine, because we realized with time that it was getting difficult to explain the stratified medicine term. Personalized is more global and is more well known as compared to stratified medicine term. So currently, with the recent revalidation exercise of our course, the name of the course has changed from BSc Honors Stratified Medicine to BSc Honors in Personalized Medicine. Okay, so moving on to evaluation, how did we evaluate the teaching and learning and feedback interventions we did? We did student surveys, which were fully anonymous, and we conducted those surveys 3 times during the first phase of the module, because that particular phase of module, the first 6 weeks, were focused on the computer programming part. So we started, the first anonymous survey was right at the very first hour of the first week, which means there was no teaching intervention at all. So it was like a base data collected at the base level, where no intervention have taken place at all. And then around week 4, which was like the middle of that phase, where they already had one assessment done, one summative assessment done. And then at the end of week 7, which is after the completion of the computing programming topic. Now, we also included some quantitative and qualitative questionnaires. So it was not just quantitative multiple choice of questions. We also asked them some qualitative responses, like a free text response to several questions. And in terms of, now I move on to the methods. So what basically teaching, learning, and assessment and feedback approaches were used as an intervention. So when I joined Ulster University in 2016, the timetable I got in terms of teaching this particular module said to me that I have to give a lecture for 2 to 3 hours on computer programming and data analysis in the morning session of a day. And then on the same day, after lunch, I am supposed to run a 3 hours practical session. Now, me, who has been in the shoes of those students, I too come from a biology background. My first degree was in biological sciences, and I learned programming with time by going through my master's and PhD and so on. So I do understand that programming is something which you could only learn when you actually do it. So for me, delivering a 3 hours lecture on theories and concepts of programming wasn't really something very attractive. So what I did, I tried to manage a computing room, not only for the practical session, but for the morning session as well. And in the morning session, I ran some workshop. And with the workshop, I mean, it has to be very active engagement, active learning based, right from the very first minute, very first second of the teaching, that every concept or every logic of programming, which I was trying to explain, I asked the students to try it, test it then and there on the computer to see what exactly it means, what I'm trying to actually explain before moving on to the next concept. So the morning session was all about learning concepts, learning terminologies, learning vocabulary, because in the end, this computer programming or scripting is a different language, and that's why they are called as programming languages or scripting languages. So even though the English vocabulary is used, but that vocabulary could mean quite a different thing when it comes to programming. So it's important that one gets a proper grasp and understanding around each of those vocabularies and terms and logics and concepts. So it was like one concept at a time, understand it, try it, check it, what it means before we move on to understanding a new concept. Then in the afternoon, which is after lunch, 3 hours tutorial session, I gave them a problem to solve. And the problem was biomedical science data analysis related problem, which as a researcher or as an analyst, a biomedical science person encounters every now and then. So simple exercises based on biomedical data analysis. But the idea was that in the tutorial session, they are supposed to lead and not me. So in the morning session, I was leading, whereas in the afternoon session, they were leading, and I was acting more as a facilitator, trying to help them to resolve the problem. But they were supposed to drive the solution and find the solution of the problem. And this involved discussion, among each other, working together in groups, debates, and so on. Because obviously, in computer programming, you could have multiple solutions for the same problem. And for them, it was quite exciting to see how the same problem could be resolved by different ways. So that was in terms of teaching, the first pillar of teaching and learning. Then in terms of assessment, the original idea of the timetable was to give them a closed book full. It was 100% coursework, which means there was no examination, which was good. I mean, I really liked that part. But in terms of coursework, it wasn't, what was missing was this open book nature, which I like quite a lot, in the sense because when it comes to the real job scenario, when you go to an industry or you become a researcher, no one says to you that, hey, don't look into the books or don't talk to anyone or don't look into internet or don't consult your notes when you're trying to solve a problem. So the idea is not that we are not supposed to test memory of people. It's more about testing how well the brain is trained in thinking process, especially in this context, how well the brain is actually trained now in terms of computational thinking process and ability to solve the problem rather than memorizing the concepts or syntax or vocabulary of computer programming. So it was changed from closed book assessment to fully open book practical assessments, not theoretical, totally practical assessment. In terms of feedback, I believe that a feedback is not a feedback until and unless it doesn't really feed forward. So every week tutorial session, the afternoon tutorial session, was more of a formative assessment, whereas they had like 2 or 3 summative assessments. So summative assessments, those assessments which actually count in their final grade. But formative assessment, I hope everyone knows that. Well, formative assessment is when you are just trying to learn the process rather than your grades are not really counted. So every week in the tutorial, it was a formative assessment, and the solutions, I used to look into those solutions, and then in the following week's workshop morning session, I used to give them examples of different ways of people have tried to attempt to solve the problem, and what are the pitfalls or what are the drawbacks or what are the good things about those different approaches. And so the morning session before the workshop, half an hour to 1 hour, we used to debate and discuss the solutions which students have achieved from the previous week's tutorial session. So that whatever mistakes they are doing, that should feed forward on that particular week's afternoon tutorial session. So it was a one-day affair, and so which means the teaching continued from morning 9 o'clock until 5 o'clock with a 1 hour lunch break in between. but that's how we try to consolidate our teaching here in Ulster, so that I can have other 4 days for doing my research and focus one day on full day on teaching. Yeah, and students were asked to comment, question, and apply understanding to those examples which I used to cite, bringing from different other students' solutions. So that was all about the teaching interventions, methods, and then coming to results, starting with the quantitative results. Comparing the responses students gave at the start of the module, comparing those responses with the modules, with the survey at the end, there was a decline of 29% of those students. So number of students reporting that they found programming stressful, that declined by 29%. Now, in terms of anxiety, the same pattern was noted, that the students who were reporting that they felt anxious about learning programming, that got reduced by 22%. And the most striking finding, or most overwhelming, or I must say what made us quite happy about the work we have been doing, was this improved confidence. So all the three interventions of teaching, assessment, and feedback, and among those, especially the open book assessment, had the major impact in terms of number of students who were now reporting that they have an increase in their confidence, that went up by 65%. So that was quantitative. In terms of qualitative results, what I'm presenting here is called spectrum display chart. And this is a way of presenting the qualitative data. Each dot or each circle or each point, what you see here, which in orange and blue, is one student. The orange student are those students whose response or the qualitative feedback was more driven by affective responses, whereas blue are those students whose qualitative free text response was more of a cognitive response. And then on the left-hand side, you could see the results from pre-intervention. That means, the first survey we did at the very start. And then on the right-hand side, is the survey at the end of the module. So the point here is, from these results, what we can clearly see is that as the module progressed, the response of the students changed for most of them from affective to cognitive. So affective responses are those which are actually driven by stress and anxiety. And this changed to more of a cognitive response as the module actually progressed. These are some snippets from the responses we got from students. And obviously, even at the end of the module, students still say, which we all agree, that programming is challenging, it is stressful. But what made us happy to hear from them was to hear that they feel that more comfortable, they feel more comfortable, and they feel that the learning programming is now more manageable, even though it involves steep learning curve. But they were more confident, more comfortable, and they felt they can manage to learn programming even beyond the class and go and work on their own as well. So that was quite pleasing to hear, to see their responses. So in terms of conclusions, the team came up with three major conclusions from this report, from this work in the final report. The first was, we believe that the review of the structural elements of a particular topic, that has to be done properly right at the start. So what exactly is the content and who is the audience for that particular content? That really needs to be thoroughly understood right at the start, so that one can aim to design better learning and teaching methods with a goal to reduce the stress and anxiety, and therefore in turn that will help in increasing the student well-being. So review of the structural elements right at the start of the module, that was the first conclusion of the team. The second one was changing the perception of the students. So like we often see that students come to the classes as a passive listener of the lecture rather than actually actively engaging in the conversation, in the discussion. So that perception of the students, which I noted right at the start, that most of them, like most of the students, they were like very comfortable to just sit in the class and hear and just go leave the class. But that perception have to really change, because the subjects such as computer programming, which are more of an active and hands-on learning sort of things, if you don't conversate, if you don't discuss, if you don't talk, if you don't engage, it becomes more difficult to learn subjects of such nature. And therefore, that perception among students of being a passive listener, that has to really change, and it has to change towards more of an active participant right at the very start, right from the very start of the learning process. And then the third and the final conclusion we made was in terms of the cognitive demands. So the cognitive demand of assessment and feedback, well, in terms of assessment, we believe that it should not be, the cognitive demand should not be towards the testing of the memory. It should be more of assessing how well, like I said, how well the brain is actually trained now in terms of computational thinking, the thought process, reflective process, and an ability to solve problems. And the feedback should be more of a feed-forward nature, where students should learn from their mistakes done from the previous assessment, previous formative or summative assessment, and then try to pick up from their mistakes, and so that they don't repeat the same mistakes going forward. And this whole assessment and feedback process is like an iterative loop, which needs to be followed in an iterative fashion. So those were three conclusions which we made at the end of the report, and that's the end of the project. Finally, I would like to acknowledge the two team members, Professor Stephen McLean and Dr. Elizabeth Hitson, for their valuable contribution in this project, and obviously the funding body who gave us the money to execute the project. And some further reading and references, I would like to draw your attention towards this report, which is available online on the Advanced HE website, where we have tried to present in quite detail about the whole process of this project, the findings made. There's a lot of infographics available there in terms of what was done, how was done, and what were the outcomes. And there's also a section about how actively we are trying to disseminate the findings we made in this particular project. In the center is Professor Stephen McLean, and on the right-hand side is Dr. Elizabeth Hitson on the screen. Then some references which I have cited regarding the challenge of computer programming, how difficult it is, and then the blog from Alexander Jensinis, and the positive pedagogy, which was coined by O'Brien and Blue, and then two of our articles which on which this whole project is based on, which have been used as a dissemination process as well. So thank you very much for your time and for listening patiently, and I'll be more than happy to take any questions and discuss any of the points I presented here.